pain in the workplace. It affects over 100 million people a year. How do we address it? We know that by the nature of some of the jobs that your teams do, repetitive motion, overexertion is creating a lot of injuries. It's one of the leading causes of both fatal and non-fatal injuries, and it's really something that has to be taken seriously. You start thinking about the rising healthcare costs. It's getting more costly to get better. It's getting more costly to stay healthy and not get injured. And so more and more organizations are trying to figure out, how do we stem this? How do we control this? It's about what can we do as an organization to affect this. We have a client, 10,000 employees in North America. They have $3 million a year in worker comp claims that are MSD related. $22 million a year in their healthcare side. Started in the safety arena and health and safety, and it's now migrated to a corporate initiative to try to eradicate a lot of that cost. We have wellness, we have safety, EH&S, we have risk. Let's start looking at the employees a little bit more holistically and bringing these programs together. You still can have your separate budgets, but how do you bring them together and look at the employees differently than you have before, and then come up with programs that really address all of those areas. You got to have senior management support. These are all traditional, any program you're going to do. You got to eliminate the barriers to access. Empower people to take ownership. How do we get the employees more engaged in the process? How do we empower them to take ownership of their own healthcare, of the safety of the organization? And as any program, measure, metrics, and understand it. The employees that you work with, they're your customers. Those are the people you have to take care of. So the culture is important. It's really about the people and how they're doing their job. So assess those risks, those high-risk areas, and understand what you're trying to accomplish with that plan. And then you got to empower and educate and train. Pick your elements, pick what's important to you, what is going to work for your organization. But at the end of the day, bring it together under one brand. So if you have wellness initiatives and some safety initiatives and some other things, brand it. Call it something. Make it visible. Make it loud. Make it clear. You want to increase productivity, and obviously you want your employees to be healthier, safety, and happy.